All right, in lessons 9C and 9D, we're going to continue to look at how we can compare different categories of data. And also it has to do with risk assessment. How accurate is our data? So let's move on. It says a streptococcal bacterial infection causes a severe sore throat known as strep throat. I'm sure most of you have had a case of strep throat. And it is cured using a particular course of antibiotics. And there's several that are effective on strep throat: penicillin, amoxicillin, augmentin. It says, however, a staphylococcus bacterial infection, so now we're talking about staph, also causes a sore throat, and it is treated using a different course of antibiotics. Therefore, correctly identifying the cause of a sore throat is crucial to prescribing the correct treatment. How did you know you had a strep throat? You went to the doctor and they did a test. They do a little throat swab. Our main objective is that a percent can be used to express the likelihood or probability of a certain event. Selecting the appropriate comparison value and base value is crucial for calculating a percent correctly. We're going to be able to extract relevant information from a two-way table and select the appropriate values to compute probabilities. It says, suppose 500 patients visit a walk-in clinic complaining of a sore throat and other symptoms consistent with a strep throat. Clinic physicians order a diagnostic test. A positive test indicates that the patient has strep throat. A negative test indicates the patient does not have a strep throat. However, medical tests are not 100% accurate, so the results of the test may be wrong. This means the test may be mistaken even when carefully administered. It says complete the table to show how often the test correctly diagnosed cases of strep throat. Remember that a positive test indicates the patient has strep throat, but the test is not always correct. So, column 1 says sore throat patients with streptococcal infection. So this column right here, these are our strep throat people. Notice 96 of them, the majority got a positive test result, but 24 did not. So we had a total of 120 people that do have strep throat. Notice if we go across sideways, 120 plus 380 gives us that total of 500 people that were tested. We need to fill in the rest of this. I can't do this because there's two blanks, but look, I can figure out this. 385 people got a negative result. 24 of those were in the column where they actually did have strep throat, but the majority, of course, did not. When you get a negative test, your assumption is you probably do not have that illness. Okay, now we can complete the rest. If I do 380 minus 361, you can see 19 people got a positive test. Even though they did not have strep throat, nevertheless, they got a positive test. If I do 96 plus 19, I get 115. And you can see 115 plus 385 also gives us 500. So our table works both ways. The top row is everybody who got a positive test. 96 actually had strep, 19 actually did not, but they all got a positive test. The second row tells us who got a negative test. 24 of those people did have strep throat. Their test was wrong. 361 did not. Their test was, of course, correct. It says use the figures or numbers in the table to answer the questions. Report probabilities using a percent. The sensitivity of a medical test equals the probability the test is positive when it should be positive. Compute the sensitivity of the test for strep throat using the following steps. How many patients have a streptococcal infection? Well, the answer to that is 120. Everybody in column 1 has strep throat. How many of the patients with a strep throat or strep infection got a positive test? That would be 96. So C says, if a patient has streptococcal infection, what is the probability that the test will correctly diagnose the patient with a positive result? The answer is called the sensitivity of the test. So 96 people that were infected out of 120 who actually were sick, they actually tested 120. To make that a percent, comes out to be exactly 80%. So 80% of the time, the strep test gets it right. It tells somebody with strep that they have strep. The specificity of a medical test equals the probability that the test is negative when it should be negative. Compute the specificity of the test for strep throat using the following steps. How many patients do not have streptococcal infection? Well, there were 380 that do not have strep. How many of the patients without a strep infection received a negative test? 361. Whoops. Yes, that is correct. How many of the patients that don't have strep got a negative test? Well, 361 do not have strep and they got a negative test. If a patient does not have a streptococcal infection, what is the probability that the test will correctly result in a negative outcome? So, we're going to compare 361 to 380. Before we were going positives to the total people that should have been positive. This time we're doing negatives to the total people who should have been negative. And that actually came out to be 95%. So the specificity of the test is pretty good. If you do not have strep, it will probably not tell you that you do, but it will sometimes. But this is just a continuation. Doctors diagnose symptoms, but they also rely on medical tests to confirm their diagnosis. Unfortunately, medical tests involve some chance of error. In some cases, patients test positive for a disease that they do not have. In other cases, the patient has the disease but tests negative. In this lesson, you will evaluate the accuracy of the test from the previous lesson. Let's go back for just 1 minute. The sensitivity of the test was comparing how many positive results to the number of positive results we should have had. This test is basically, sensitivity is saying, are we getting it right? And we got it right 80% of the time. 96 of the 6 people got a positive test. So the positive test was correct 80% of the time. The specificity is saying, okay, how often is the negative test right? Well, the negative test was right 95% of the time. We should have had 380 negative tests. We had 361. So sensitivity and specificity both deal with the test giving you correct results. Positive results, 80% of the time that it should be positive. Negative results, 95% of the time when it should be negative. So if you get a negative test, you should feel really good. If you get a positive test, you should feel pretty good, but there's a little more doubt. Okay. These next are about when the test is in error. There's our table. It says, think about the patients with a streptococcal infection who received a negative test result. These test results are false negatives. False negatives means you got a negative, but you should have gotten a positive. These are your false negatives. Okay. We also have false positives. We're going to talk about those too. These people did not have strep, but the test said they did. So these are the people where the test failed. These 96 people got the correct result. They had strep. It said they had strep. These 361 people did not have strep. The test said they did not have strep. So false negative says you didn't, but you did. False positive says you have something, but you don't. So how many false negatives? There were 24 false negatives. A patient receives a negative result on the test for strep throat. What is the chance, rounded to the nearest 0.1%, that this negative result is false? Well, 24 out of 126 people got a false negative. It's 20%. I was thinking about the positives. If you remember, the sensitivity, which was when the test got it right if you were sick, was 80%. So 80% of people with strep get the right result. 20% get a false negative. What do you think a false positive test result means? Well, it means that we're moving into this group. These are false positives. It means the test says that you have strep, but you don't. There's lots of false positive tests. If you take a pregnancy test and it says you're pregnant, but you're not pregnant, that's a false positive. It's when the test says you have something, but you really don't. A doctor finds that a patient gets a positive result on the test. Knowing that the patient's test is positive, what is the approximate chance the result is a false positive? Well, out of all the positives, there are 115 positive tests. Whoops, that's not what I wanted to compare it to out of this. Let me think. A false positive means somebody got a positive who should have gotten a negative. 380 people should have gotten a negative test, but 19 didn't. That is 5% false positives. That goes with the 95% specificity. I think I'm misspelling specificity. There we go. They should add up to 100. If you don't have strep and they test you for strep, 5% of the time you're going to get this positive test that you should not have gotten, a positive result. 95% of the time when you get that negative result, you're going to be correct. How should the doctor think about this percentage? What should the doctor do with this information? Well, he just needs to realize that every now and then he's going to get this result that says positive, but occasionally it's going to be wrong. That's why doctors need to rely on other symptoms as well as diagnostic tests. It's also why sometimes they'll repeat a test, or you'll say you test negative for strep, but if you're not better in 2 or 3 days, call me back, because they know once in a while the test will be in error. You can use different percentages to describe the accuracy of a test. A test is accurate when it results in a low percent of errors, false positives and false negatives. Pick one figure or percentage that you think best describes the accuracy of the test. Explain what this figure says about the test and why you picked it. Well, a test is accurate when it results in a low percent of errors. I would want to know the number personally of false negatives. If I get diagnosed with something and I don't have it, I probably won't be harmed by that. But if I have something and my test says I don't have it, that might harm me. So in this case, my false negatives, 24 out of 120 is about 20%. So I would just want to say that when I get tested, if it says that I don't have strep, that 20% of the people that do might get that reading. It's just a way to think about it. Just now think about how to figure a percentage to describe the degree to which the test is inaccurate. Test is inaccurate when it results in high rates of errors, false positives, and false negatives. Again, you can pick whichever one you like, but it's important just that you understand what the different figures mean. All right, that's going to wrap up these lessons, and if you have questions, as always, email me or ask me during class.